32-year-old male, and 1369 also 32 years old, and also took KA734. We can't confirm the origin. We've yet to locate him because he provided an incorrect phone number. And 1373, a pilot returned from Kazakhstan. When we locate him, he already left Hong Kong. He went to U.S. last night. We will notify the U.S. authorities. And 1399, a Philippine ship crew. Well, since placed earlier, we already put him in quarantine center. Well, not this one. 1392 was the shipping crew. 3X906. He took the flight on 9th of July, and he's put under isolation hospital. And 1399, the last imported cases. There's a close contact of 1309 since they came to Hong Kong together. And they were sent to hospital from quarantine center. On 9th of July, he started having fever. And on the 6th of July, that's the date of his arrival to Hong Kong. And for other cases, local confirmed cases, 10 of those related to earlier cases. 1394, he went to a Bunki, a 39-year-old female. 1388 also went to Bunki on 28th of June, and his wife was 1389 did not went to Bunki, but they are a couple. And 1388 is a 70-year-old man, and 1389 is a 70-year-old female. 1391 used to be a taxi driver and did not work for the past 2 months. And they had contact with case 1329. He was a taxi driver. And 1329 have driven him and had a chat. Thus, they have the confirmed cases that's linked to earlier cases. And the family members are 1391, 1402, 15-year-old girl, and 1403, an 8-year-old girl, are confirmed cases. And yesterday, I said that 1402 went to the Christian Alliance S.E. Chan Memorial College. While another case study at Taoist Ching Chung Primary School in San King Estate, Tuen Mun. (1396). After we talk about Bunki, let's talk about the Sun Fat restaurant. 13896 on the 3rd of July had visited the Sun Fat restaurant, and he was a relief driver on the 6th of July. And on the 3rd of July, he went to Sun Fat restaurant. 1371. (60-year-old boy), and 1374, 51-year-old female. 1398, a family. They're all family members. And the 26-year-old man, so the mother and his 2 sons. And 3 of those are confirmed cases. Well, the father is also a taxi driver, but doesn't have any symptoms. Yes, he is also a taxi driver. May have some connection with the earlier taxi driver cases. So these cases are the relevance to the past cases. We have 11 cases had to do with Mingchun House of Soichun O Estate. We had one case, 1294, he left and the Mingchun House of the Soichun O Estate. Therefore, we distributed the death throes sample bottles to the residents. And of the bottles returned, 11 of the cases live in that building. We are quite concerned. And this morning, well, with the EP Environmental Protection Department and the Housing Department experts went down to the Mingchun house to inspect the pipe works. And it was found, well, since they're right standalone and are not joined together, of the 10 units, with 11 cases, 2 sharing the same unit, they're right scattered on different floors and in different directions. And like in earlier cases, they will have with the same direction. We see that it might be had to do with the sewage pipes, not directly related to them. However, it had to do with the shared common facilities like the environment or like the lifts. So for the common areas and also the floor, we also extract some environmental samples. We also asked the 11 cases in Mingchun House. We know that a lot of them had visited the shopping center, the wet market, and restaurant at the Shuichun O shopping center. Therefore, we will hand out test sample bottles for those who work at the shopping centers, hopefully to yield any clues. Besides these, 1398, not this, 1395, but the Kong Tai care for the H Center Limited residents. He started feeling unwell at the quarantine center and transferred to Queen Mary Hospital as a confirmed case. So we have one more confirmed cases. And 1404, 18-year-old man. On 28th of June, is the son of case 1352. His father was free to leave the center for a walk and surroundings and visited the Chiwon-san shopping center. And 1404, and during the weekends, would go to the elderly home to meet his father and go hang out at the Chiwon-san shopping mall and roam around in the community. And on 28th of June, the father had returned home for Father's Day dinner. So we had to deal with the outbreak at the elderly home as well.
And besides those cases, there are also 9 cases of which we could not find the source of infection. They're not really closely related to the previous cases. One 1368. Case 1368 is a 40-year-old female. She works in Shaosha in Yaotong, in the shopping mall there in Yaotong. And her husband, 1440, was a confirmed case, 40-year-old man. He makes metal frames, gates in Full Tan. Another case, 1375. 1375 is a 13-year-old female. She studies at Tet Mong School, lives in Jianggunnou. Good Hope School, that's where she goes to, and she lives with her family. And on July 7th, she had fever and runny nose. Usual days, besides going to school and staying at home, sometimes she would actually receive tutorial lessons from tutors who goes to her home, or she may go to the tutor's home or go to painting lessons as well. During the incubation period, her close contacts during the period would be sent to the quarantine center. In school, there are several schoolmates of hers who were closer to her, and those students will be sent to the quarantine center. And then 1376 is a 41-year-old female. She works in Taikushing. She lives in Sao Mau Ping Estate, On Tech Estate Hotel House. She, well, as we could find, didn't show any high-risk factors, like she had not been to the places we mentioned, high-risk restaurants. 1393 is an 89-year-old female. She was actually the wife of the case 1365 confirmed yesterday. She did not show any symptoms. And the other case, 1397, is a case of which we cannot find the source of infection. A 40-year-old man. He lives in Choi Wan Estate, Xingshen House. He, didn't show any high-risk factors. And also 1390. 1390 is a 35-year-old male. He opens an educational center in North Point called Chunyin, where there are several teachers there, and also his wife will be sent to quarantine center. He lives in Zhengguan-o. During the incubation period, we couldn't find any high-risk factors associated with him. 1372 is a female, 47-year-old. Because we built the doctor to May War Chair, and she is the case identified there in War Chair, May War House. And she was living in a different unit from a previous case confirmed there, facing a different direction. She works in Marks & Spencer in Moss Town. Her close contacts, friends that she had contacts with, would be sent to quarantine center. And the last case I want to mention is 1401. 1401. Early on, we have seen cases who live in Choi Wa House, and that's where this woman lived as well. She had not had close contacts with others, but she lived in this particular estate where we had found several cases early on. There are 4 units which had cases, of which 3 units have family members who've been to Bunky or Sunfed restaurants. So that could explain why they were infected. So these cases, compared to other cases, confirm, in terms of their locations and facing the directions they face, are not closely related. Dr. Ho, please. Good afternoon. By noon today, in the past 24 hours, the HA submitted 116 cases to us systematically. Compared to the cases still in the hospital, there are 274 patients still receiving treatment at hospitals and being isolated. In the past 24 hours, 11 confirmed patients have recovered and been discharged. So far, 1,180 patients have recovered and been discharged from hospital. So far, 172 confirmed cases are in 9 public hospitals undergoing treatment. Among them, 2 are in a critical condition, case 595 and 1315. Both patients are in serious condition. Someone in a serious condition there are also 168 patients who are in stable condition compared to the previous ones who are neither in serious or critical condition. By 9 this morning, our number of negative pressure beds number 1149, usage rate is 59%. Negative pressure wards number 590, usage rate is 68%. You may have noticed that recently there have been several clusters of confirmed cases, and suspected cases have been admitted into hospital as well. Among these patients, many are relatively old. On average, they are aged about 60, and some are in the 80s. And also, since some of these patients have chronic diseases, and that could actually worsen their condition, so the days spent in hospital could increase, and this will have implications on use of our negative pressure wards. Right now, we have 1,200 isolation beds to receive patients, but lately we have adjusted arrangements for patients, and we will reactivate our 500 second-tier isolation beds to receive patients who are in stable condition and who are recovering well. And also, we have set up triage stations at hospitals. The symptoms of patients with mild symptoms could be wait for test results at the triage station in the A&E department, so at public hospitals, so as to actually reduce the pressure on demand for isolation beds. And I believe that our measures and facilities could ease the load on our wards. And if the measures prove to be inadequate, then we could reuse some isolation facilities in the community, so that patients without symptoms or who have mild symptoms could be sent to isolation facilities in the community, so that more beds could be vacated to accommodate patients who are in a more serious condition. And right now, we're actively preparing the work involved,
which included arranging our healthcare staff and the computer system connection and some medical equipment, catering arrangements, and transport logistics. As for the infection control, we have provided the personal protective gear, independent ventilators, and disposable bed sheets, bed and linens. And at the same time, the patients will need to be admitted to the community quarantine facilities. We are planning the process. As soon as we make a decision, we can activate these measures ASAP. And in order to strengthen our capability in controlling the infection, we may suspend non-emergency services. We're currently review our manpower and the service volume, and among other factors, and these measures may affect those who are non-emergency cases. I hope that you can sympathize and understand of this need. And also, like to announce on the stockpile for the PPE. As of today, the surgical masks we have 31 million, and the respirator 2.6 million, protective suit 5.1 million, and for the face shield 8.7 million. And the stockpile is enough to last for 3 months. But as you can see, and as the pandemic situation is unstable, will continue to pursue through different channels to procure more PPE. At the same time, we'll proactively explore any substitutes for PPE so as to enhance the inventory for our PPE. So that's the end of my announcement. We're now open for the questions. Please put up your hand and speak through the microphone and state the media organization you represent. And a maximum 3 questions. Now news. As Soi-Chun O Estate have many confirmed cases, besides Ming-Chun House cluster, would any other cluster also, cases also live in Soi-Chun O Estate? As just say about the imported cases, there one is untraceable. And how would the Department of Health deal with it? Any way to trace them? And we see the 9 cases of unknown origin, and they don't see a connection of where they live and work. Do you think that the pandemic have lost control? Would it have other cases from Soi-Chun O Estate? Well, there are quite a dozen of blocks in Soi-Chun O Estate. Currently, they only have cases in Ming-Chun House. However, I appeal to other residents. They have to be mindful of their health, see a doctor if they're unwell, and undergo testing. And for the untraceable cases, well, we're still trying. It might have to do having left Hong Kong. We already reached to the immigration and the police force, and also contact the companies and see where to locate. But however, we're still not able to find him as of time we speak. I'm quite worried. It seems the spread of local cases is quite extensive, and the whereabouts of these cases seem to be going everywhere. I can't just let it exhaustively or where had they been. So in terms of tracing close contact and the sources, that pose a huge challenge for us. Thus, we are very concerned. And looking at foreign experience, if they have some shortcomings in the infection control, it could be highly contagious. It could multiply by manifold or going exponential. Well, as we tend to wear masks, the situation may be better. It seems that it's quite a quick spread. And we asked the confirmed cases about the family members. It was hard to wear a mask when you're with your family. When we asked about these cases, a lot of the family members are also feeling unwell, and we sent them to hospital and put them undergo testing. Well, we should either send them to quarantine center or hospital. A lot of them will start showing symptoms or have symptoms early on and sent to hospital directly, which they may be confirmed soon. It shows that it is highly contagious. Next, the lady in white with glasses. Hong Kong Economic Times. The Soi-Chun residents recorded many outbreaks that are panic and start moving out. Are you worried that you will lead to this further spread of the pandemic? And a question for HA on the community quarantine facilities. How many of them do you have planned for, and where they're located? So what are the conditions for selection? And what facility will be provided? Will be the negative pressure facilities, and when will be commissioned? And what is the capacity? And second, do we have any preliminary confirmed cases? And for the Ming-Chun House residents, many of those that undergo testing. I don't have the latest figure at hand. A lot of them have tested negative. However, testing negative doesn't mean, it just showed that they're at that moment they are fine. Well, whether for the residents or to everyone in Hong Kong, they should be mindful of their own health and follow the infection control measures. We're not banning or locking down the Ming-Chun Health residents. Well, even if they're not moving out, they still get to go to work or go to school and so on. For all these type of activities, they should minimize as much as possible. And for preliminary confirmed cases, I know that they are keep coming. I don't have the latest figure yet. As for the quarantine facilities, or the isolation facilities. We have inspected a lot of sites, and we also done a lot of preparation work. I must stress that we will choose places that are away from the residences. However, also be also feasible in terms of logistics. We haven't choose a particular site as to when would they be activated. Well, very much depends how the pandemic unfold. If we decide to commission them, that our early preparation work is going on full swing. The gentleman in the last row. HKO1. As for the 32 cases in Kong Tai Care for the Aged Center, well, the building of where it is located have 2 elderly homes. And in this case, it's the Kwang Tai Care for the Aged Center Limited. Another still operation is called Kwang Tai Care for the Aged Center. Even though they're registered a different company, and some residents see that the workers are going back and forth between the 2 centers. So for those who work there but still not under quarantine, they could still be close contacts. We suggest that the Kwang Tai Care Center they're still operating as a high-risk area instead of the one closed. We suggest that the Kwang Tai could close for the time being. As in the same building is a Winfair Mansion, and some of the residents complained as of today. Now, they still not undergo testing, so they are very worried. So where will they arrange to undergo testing? Are you afraid that if there any delay in testing, they will let the further spread of the pandemic?
We are aware that the Kwang Tai Center actually is below another elderly care home called the care home in Chiwon-san, and there are staff there too. When we move residents out of the care center on that day, we found that there's another care center as well, care home, and we've distributed the sample bottles, to all the nursing homes, including the Chiwon-san Yukhwa nursing home in the same area, and our staff also give advice to staff at the other 2 homes. The difficulty with nursing homes is that you cannot suspend their operations because the elderly residents there need to be cared for on site. So you cannot just close operations there because where else can the residents go? So we are having close monitoring of the situation there. If there are any cases identified, then we'll see what we should do. Regarding their staff, some of the staff are not full-timers, and they work for both homes. And we will send them to a quarantine center. The 4 confirmed staff, one of them actually did cleaning work in the center above, but we haven't found any outbreak there. I hope not. As for the mansion itself, residents there, we have been distributing the saliva sample bottles there, and because of the backlog of cases from earlier days, so we could not give the bottles to everyone yet. But anyone who's worried can email us, and they need not wait for a bottle. If they haven't received it, they can actually see a private doctor first. Okay, the lady in the middle, in the brown, in row 3, the 3rd row, please. From cable TV, on the Mingchun House O estate. At this stage, are you thinking of evacuating some of the residents? Just then, Dr. Chung said residents still go out and go to work, but would that constitute a risk to the community? And also, we have seen a number of cases in public housing estates. Is Mingchun House the estate where most number of cases have been found? Dr. Chung also said that the virus load has been quite high recently. Is it because of the large cluster there? And also, the double-digit local infections. Do you think that it's too late to suspend or to close schools next week? And how are you going to assess the risk on campuses. And they've also been concerned about postponing the book fair next week. Given the outbreak of local cases, do you think there's a need to suspend or to delay the book fair? If not, what recommendations would you give to the public? I think for Ming Chun House, it's quite different from the case in Lake Yun. The experts have been there at Ming Chun House, and they found that because the pipes are on the outside rather than hidden inside or indoors, because in Lake Yun Estate you find the pipe in the bathrooms, but for this latest block, the pipes are not joined together and they were actually shown or exposed on the outside of the building. So the experts feel that they could rule out the chance of infection through the pipes. But residents going up and down within the building, taking the lift, or meeting each other in the common area, that could be a source of infection. I don't know whether that's related to the spread of the virus, but whether it's directly related to the spread of the virus, we need scientific evidence. We can't just make a guess. But I know that the Education Bureau has arranged for schools to be closed from next week. I hope that that could help ease the transmission. As for the book fair, I think it's up to the authorities to make the arrangement. Okay, lady in black in the front, please. Commercial radio. In the past few days, students from various schools have been infected. In Wong Tai Shin school, there was a student that was confirmed. So what is the latest situation? Is it that for each school with confirmed cases, the entire students of the entire school have to be tested? Because students have spent quite a long time in school. How can you assess who or which students are close contacts of a confirmed case? And I'd also like to ask you, Kazakhstan has the outbreak of a mysterious pneumonia. So have you looked into the situation? We have imported cases from Kazakhstan. So how are you going to assess the risk? Have you studied the situation of these confirmed cases? Anything peculiar? And also, experts have said that people coming from Kazakhstan, this mysterious pneumonia there, for people coming from there, should those coming to Hong Kong from Kazakhstan be placed under special measures to avoid cross-infection? For schools, we talked to the students, we asked them about the situation, and actually the infection control measures were quite well. Many just went to school for half a day, didn't eat there, and they wore masks in class the whole time. So the chance of having a close contact was rather small. But some students may be particularly close to some of their friends and talked and have activities together after school. Of course, those would be their close contacts. And within schools, they would take off masks and have snacks. And those who had snacks together would be classified as close contacts as well. For those schools with confirmed cases, I've given them sample bottles to do the testing just in case, to avoid transmission. We've been distributing the bottles, the sample bottles, to the school students. Like in the case of the housing estates, we are trying to liaise with each school with confirmed cases. As for the close contacts, schools with close contacts, well, it will see whether they are close contacts of a confirmed case. If a case tested negative, then of course we wouldn't send bottles. But if the close contact was a confirmed case, then of course we'll distribute the bottles. We would monitor the situation in Kazakhstan and how different those cases are from the other COVID-19 cases. For the arrival in Hong Kong, we would go up for early testing. For aircrew, since they are exempted people, sometimes it may not be easy for us to hold them or to trace them, and that could pose a certain amount of risk. Lady in denim jacket, please.
A few questions here. First, regarding a Shui Chun O estate. are there any plans to evacuate the building, seeing as there are 11 new cases today? Are you working with the local community or the district councillor to conduct more targeted testing? And if there is, what is the numbers right now? Second of all, there is a elderly home below the building of the in O estate. Are you aware of this? And is there any methods to test the elderly in that center? And third of all, it was mentioned in the past few days that people flying in from high-risk countries are required to do pre-boarding testing and a certificate. What is the progress on this right now? And how do you describe the situation right now in Hong Kong, seeing as there's a lot of cases which seem to be unrelated?
We have no plans to evacuate the residents of the Ming Chun building because interdepartmental expert group has been conducted, visited the housing estate just today and found that the possible there may be possible environmental contamination in the building or in the nearby malls or common facilities, but there's no structural defects that can be found that can explain the transmission between the residents because the units are in different directions and the sewage system are not interconnected. So it's very not likely that the sewage or drainage system that can explain the spread among those units. So of course we are advising the residents to keep a close monitor the health situation and also the other residents in that estate to monitor their situation and health condition and seek medical advice as soon as possible if they have any symptoms. We are also distributing testing bottles to the vendors of the shops in the mall and also in the markets because some of the residents, affected residents, they said they visited some of the restaurants or the supermarkets or the markets in the estate. And we are aware that there's another elderly home.
And where there's an elderly home at the bottom of the building, we also hand out this
to test the staff as well as the residents. And so far, no positive result have been found yet. I understand the high-risk travelers going back to Hong Kong, the arrangement is being discussed and not yet implemented. And we're worried about the locally acquired unknown sources cases. And because according to the trend in the recent few days, the spread of the infection seems to be very quick. And also many of the close contacts of the affected cases also claim to have symptoms. So it is possible that more cases will come, and there's a possibility of a big community outbreak.
I would like to clarify my question. The elderly home I'm talking about is below Ming Chun building, not the one in Hong Kong.
Oh, you're talking. That one they have a separate entrance and separate. Although they are in the same building, but they have a separate entrance. But we are also distributing bottles to test them. Yeah.
下一位，後邊間條衫嗰位女士。
Mingpao Daily News. And for Ming Chun House, which of the 11 cases, though all of them are not showing symptoms, or what occupation are they in, or any high-risk factors? Well, for 1294, accidentally discovered being carrying the virus by body check. That's why this 11 cases were caught by giving out bottles. And would also hand out bottles for any infected buildings to bring out any hidden cases. And on the source and the transmission chain, do you have any idea? And there are some residential homes and rehabilitation day center at the bottom of the building, and some of the residents have already evacuated. Would you hand out bottles to them? And second, a quote for HA, on the third wave pandemic, So what are the clinical symptoms? Are any showing any difference? And Dr. Zheng just said we're expecting a large-scale community outbreak. So what measures do you plan to have, especially many elderly are being infected, and it's rumored that the ICU at the Queen Elizabeth Hospital are being vacated for the serious cases. I just want to confirm. And some question on the cases. Just now, the elderly home of 1404, the son, when did it get onset? So where had they been when they go out, and anyone had they been in touch with? And just want to confirm the owner of the education center. Can you give us the name and the address of the tutorials at education center? As for the case in Mainstream House, 1377 to 1387 and 1385 and 1378 are same family. We made inquiries to these cases. Some of the cases, well, maybe out of convenience, and they have purchased something at Siumei and also at the McDonald's, and some of them would have done their shopping at the wet market. Besides the shared facilities like lifts, we are investigating whether the wet market or the shopping center could be a source of transmission. So we'll be handing out bottles to the vendors and staff at the shopping center and the wet markets. And for each confirmed cases, we're handing out bottles for the residents concerned. That's why we managed to make this discovery at Mainstream House. Well, it seems to be an upsurge involving many buildings and giving a lot of bottles. So we are gradually handing the bottles. So some of them may be a bit late. Well, the point of this is to see if we can detect any asymptomatic cases and their transmission. Well, for everyone in Hong Kong, and if you're feeling unwell, don't wait for our bottle. You should seek medical attention yourself ASAP. And for the Mainstream House cases, some of them are showing slight symptoms, some of them are asymptomatic. And they were only tested through test of saliva sample. Some of them are very minor symptoms and may have visited a private doctor. And for the elderly homes and day activity centers downstairs, we've been in touch with them, and we also hand out the sample jars to the social agencies unit downstairs. And for 1404, well, they probably took the father out from the elderly home, and they'll have a chat or walk around the Chiwensan shopping center. Well, the father rarely ate outside, and they're probably just having a stroll, but didn't dine out, and start having a sore throat after 26. After his father is confirmed on the 9th of July, they went to the Children's Hospital A&E, and the brother was elder brother tested negative. Well, the North Point Education Center should be at an electric road called Zhenyin in North Point. What's the occupation? Some of them are students. One of the cases is a part-time station assistant at Taiwan Station for a few days in a week. Some of them are students. The MTR assistant case is 1386. One of them own a Chinese barbecue shop work part-time at a Chi-Ching Estate Chinese barbecue shop, and some of them are in office. Those are not from Ming-Chun House. Well, some of them have no discernible traits. So what school are they from? The Poliang Cook. 1378, 7-year-old boy. 1380. Worked in a employment agency for foreign domestic helper. One 1387. Study at the Kowloon City Baptist Church Yanping Primary School. As you can see, the confirmed and admitted cases have grown in number. Thus, we have reviewed our manpower deployment and also our level of PPE.
And also our ability to accommodate the patients. Looking at our first-tier isolation beds, the number about 1,200. The usage rate is 60%. For the negative pressure wards, the utilization rate is about 70%. So earlier on, we had suspected cases for which we will try to place them in isolation wards for checking. But this time, since some cases had a common source of infection, so we would, for example, for double rooms, we could place 2 patients in a double room, and so as to make good use of our resources. And as I've mentioned to you, we would also, in the coming days ahead, activate our second-tier wards so as to increase our capacity in receiving patients. For those who are in stable condition or those who are about to be discharged, we can put them in the second-tier isolation wards. And for admissions into hospital, we would activate in the A&E department the triage station. So for those who are whose condition is not serious and who could wait for test results, for these mild case patients, they would not need to be hospitalized, and then that can help with our handling, accommodating all cases. As I said, if necessary, we might readjust our elective services on our emergency services, and we also have a backup plan. Should it so happen that we have reached our capacity, we might activate community isolation facilities. So this is actually our backup plans for all possible scenarios. And as I said earlier as well, right now, for the relatively serious cases or critical cases, there are altogether 4 patients who are in that category. Our ICU, their capacities, they do have isolation facilities available. And in Queen Elizabeth Hospital, the utilization rate there is about 50-60% of the required facilities. So we still have spare capacity to receive patients in need of the particular service. Right now, Dr. Chung mentioned this also. For some patients, they came in with fever and some upper respiratory tract infection. If you look at some clusters, some patients also show symptoms of diarrhea. So we've seen quite a number of cases of diarrhea lately. And as for leaving people with sample bottles and tests from the sample bottles show mild symptoms. For elderly people, normally they would have shortness of breath and or have high fever. So that's all you can see from the elderly patients. Unlike in the early cases, like in overseas, where, as you can see in overseas, when some patients lost their sense of smell, okay, but then we haven't noticed that much in Hong Kong. But here in old people, here we've seen more cases with high fever or, fever and or diarrhea. From Singtao, Ming Chun House. Can I know what percentage of bottles have you taken back? Would you impose mandatory testing there, even if the people have not returned their bottles? If you have short of stock and if you have not distributed the bottles too late, would that increase the risk of community transmission? The 66-year-old, that is the first patient in Shui Chun House, would that person be classified as a super spreader? And also for the care home for the elderly, 1312 is a case who lived in Komei House. Can I ask you, is that person who actually live in the same hostel with a staff of the elderly people's home who are also confirmed to have been infected? And also people who have been to Sun Fat Restaurant or Bunki, how many have contacted CFP? And also, Dr. Chen mentioned earlier on that there could be a large-scale community outbreak. Would you consider when we should actually, to what extent should we change our containment strategy and then adopt a new approach in tackling the virus? And there are also people who have left Hong Kong before being confirmed with the virus. So if these people are let go, would that increase the risk to the community? And then on the book fair, I know that it's coming up, and it will be quite crowded. If you've been to, you know how book fairs are like, right, with so many people. And would you be able to track any close contacts in the wake of the book fair or people who've been to the book fair? 1394, the CV value is about 22. Is it relatively high? From what I've seen early on, the city value was quite low. That means the virus load was high. So for this particular case, it's not the highest, but compared to our cases early on, 22 is considered high compared to the previous ones. In Yuk Hwa Nursing Home, in relation to the case, the case of 4 staff at the nursing home, the other nursing home, one of them lived together with the other workers, and 2 have been sent to a quarantine center. And so far, we haven't seen any positive result. And these 2 people live together, work in Yuk Hwa Nursing Home, and we've been to, together with HA staff, we've been to the Yuk Hwa Nursing Home, and we've asked the staff there to return the sample bottles as soon as possible. We haven't found any positive cases yet from them. As for the exempted individuals, those who have arrived in Hong Kong, even though they have done tests and they may have left and we couldn't trace them, it's a source of worry to us. But they are exempted individuals, so we could not really keep them in Hong Kong. As for the book fair, we are worried. We have to see, what the arrangements will be like by the relevant authorities. As for email, well, I know about 1,000 people have wrote in through the email address, and more people are writing in. We have to look at the situation first and look at the figures first. Besides Ming Chun House, there are also other housing estates where we are distributing the sample bottles, so we will have to see what the situation is in the various estates. Of course, we care about what happens in Ming Chun House and others. Okay, last 3 questions. The first one from the English, RTHK.
Has said today that schools could still carry on with certain important exams next week. Would you consider that to be a bit too risky given the virus situation right now? And what's your advice to schools in general? And secondly, you talked about the possibility of a wider community spread. Do you think it could be more serious than the outbreak in March and April? And should people avoid social activities or dining out in the time for the time being? And also, does the 9 unknown cases and also the viral load of these recent patients tell you anything about the extent of the community spread right now? And also, thirdly, some lawmakers have proposed universal testing for people in Hong Kong. Do you consider that to be a feasible proposal? And will the government consider this policy as well? Thank you.
For the arrangement in the school of the exam, I leave it to the Education and Bureau to arrange. I'm sure they would take necessary precaution if they conduct some activities. So in the recent trend, I think that the trend of spread in the community seems to be much wider than those in March. Because during that period, the outbreak, the cases are many of them are linked, and we can find a source. And those unlinked cases are only sporadic cases, so we can still locate them and the spread and stop the spread. But in recent cases, I think the spread is much wider because it has affected the elderly homes and many elderly people in the community, and also taxi drivers, attendees of some local restaurants. So they are not in March. I think the pubs and those restaurants that affect quite a number of people, but that has not spread into the wider community. But recently, I think the cases has spread into quite widely in the community. So many of them cannot be found clusters or relationships. So we are very worried about that, because that potentially can lead to a wide community outbreak. So I'm not sure about universal testing, because unless you test all 7 million people in the community, which is, I think, is not practical at the moment. And even you want to test 7 million people, you have to test all at one time. You can't just test this and then test the other parts of the population, because the people are moving. So even they are tested negative at one point, they can still get infected from other sector of the population if they are not tested at once. So we are still. I think the most important is that those with mild symptoms, they go to seek medical advice as soon as possible and get tested. In the recent few days, our public health laboratory has tested more than 8,000 tests already. But I mean, there's still need in the community, so we are still doing it. Yeah.
答嘅呢位男士。
Apple Daily. We'll ask about the school suspension. Today, the EDB just announced that they will have the early start of the summer vacation. Yesterday, Sophia Chan, the secretary, cannot say for certain that it will suspend the class, and why the EDB announced the class suspension. When the CHP, or if they ever advise EDB to suspend the classes, why this sudden change? And also, even the EDB, even though that for the early start of summer vacation would allow the schools to decide on their own discretion to carry exams or remedial classes or makeup classes, So for a school to carry such activities or on the way commuting to school, so what is the entailing risk with? It's leave to the school to decide. So what recommendations or criteria for let the school decide whether to carry exams or make up classes? And for the students as a school with close contacts or with confirmed cases, we advise them against holding exams. And second question, as of today, how many of schools have been affected by this pandemic? For example, as students confirmed or the close contacts or students confirmed? And how many of the schools that before the EDB made the announcement, and based on your recommendation, who decide to suspend the classes? The number of confirmed cases is still rising, and also the list of schools is getting longer. I know that there are quite a few more to the list, and for schools with confirmed cases, it will suggest to suspend the class for 14 days, and also they should cancel all the gatherings involving in campus, for example, graduation dinners and stuff, because they will lead to student gathering. As for those schools without confirmed cases, well, that's also the decision of the EDB. I know when they make such decision, or for any activities, they will also put infection control as a top concern. The lady in yellow, Oriental Daily News, 3 questions. The first question, and for North Point Education Center, are they still open recently, and how many students enroll in the education center? And would the children as close contact would need to go undergo testing? And well, you see a recent outbreak in the community with unknown sources. So do you think the containment strategy need to be refined, or is there confinement as enough? We suggest the universal testing. We suggest the companies to reinstated work from home. And third question, and for the exempted quarantine persons, for terms of the pilots have been confirmed, do you see that you have missed out, and is it possible that they have brought the virus to the community? For those of KACX706 and are they all pilots or as sea crew? For North Point Education Center, well, case 1390, well, doesn't teach students. He's the owner. They probably had contact with the staff, but not directly with the students. Well, in view of this, we've been in touch with them to check the number of students, and based on the list, we'll hand them out bottles. And for the instructors and the teaching aides, we'll already have sent them to quarantine centers. As for how the number of schools involved, I don't have the figure on hand. It really depends on when we get the student list. As for the containment strategy, well, it rely on contact tracing, and put them in quarantine centers may not be a fully prevent this kind of outbreak. We'll need to rely on the public working with the government. So we'll be keep this in use and reinstate some of the early approaches. For example, going out less and dine out less, and less social activity, and work from home whenever possible. Hopefully, we can cut off the transmission chain in the community. As for the exempted persons, yes, as they are exempt from quarantine, thus they may not be subject from the DH statutes unless there are confirmed cases. So it is possible for such class of persons, if we're not able to locate them, then they could be spreading the virus in the community. That's the end of today's press conference. Thank you.